Deputy Donnelly, you have 20 minutes.
Thank you, Cian Corla. I'll be sharing my time. I'll take the first 8 minutes. And I would like to move the motion.
Thank you.
I was treated like a slab of meat. That was Roisin's testimony. A registrar fell asleep while debriefing me after I'd had a hemorrhage. That was Lucy's experience. I was baldly told, "There's no heartbeat, your baby is dead." That's testimony from Anne. My baby died 7 days after birth. I was left in the ward with mothers and their babies while I was sick and childless. That's what happened to Breda. Eileen recalled that her daughter miscarried while sitting on a chair. Helena shared this. My baby was so disfigured from the forceps, she was taken away for chromosome testing. A doctor came in, looked around and said, "Oh my God, what a mess, clean this up." Earlier this year, the country listened in horror as women from all over Ireland shared their experiences of maternity care on RTE's Liveline. And the conclusion was, once again, women are not being believed. So if no one's listening to the mothers or believing the mothers, is anyone listening to or believing the midwives or the doctors? Here's what one midwife wrote. I am in such pain following the Liveline coverage of women's experience of care in Irish maternity services. It is never anything short of horrifying to me that women and their families are being so profoundly hurt by experiences that ought to be, at a bare minimum, infused with dignity, respect, safety and care. Dangerous and unsafe is what one consultant said to me in the last 2 days. Another said, Ireland isn't in the top 20 countries in which to give birth. Dr. Peter Boylan, former master of the National Maternity Hospital, said the following, an appalling indictment of state failure. He was referring to the standard of care at the hospital where Savita Halappanavar died. There are many other reports on other hospitals and other experiences. Multiple failures were identified in a report into baby deaths at Portiuncula. The report examined the delivery and neonatal care of 18 babies and found problems with staffing, with training and with communication. It noted, I quote, a significant delay between the first signs of concern and the decision to intervene. Midwives, doctors and a host of other healthcare professionals want the best for their patients. They want the best for mums, they want the best for babies, and they are doing their damnedest. But it is becoming impossible, and they are burning out. There aren't enough of them for a start. Right now in Ireland, we have 200 midwives less than what was agreed in 2016 in the National Maternity Strategy was the safe level of midwives. We have 200 less. We have the third lowest level of obstetricians anywhere in the developed world. Now, Cian Corla, by definition, if we have less than the recognised safe staffing levels, then our service cannot be safe. And for the staff, many find themselves working in outdated buildings with outdated equipment in cramped and confined spaces, as obviously do the mums and their babies. Just today, the master of the Rotunda was forced to go public and ask for urgent assistance to build a new wing amid what he describes as an intolerable patient safety crisis. We should listen to him. I was in the Rotunda recently and they shared with me the fact that there was a fire in the neonatal intensive care unit caused by old wiring in the walls, and they said it was a miracle that no baby was hurt in what happened. Elsewhere, staff are working on MRI machines that are 21 years old. Those MRI machines are meant to be replaced after 10 years. So what of the new maternity hospitals? 4 are promised, none have been delivered or even started. The National Maternity Hospital in Holles Street is meant to be on the St Vincent's campus by now. It hasn't happened. The Limerick Maternity Hospital is meant to relocate to University Hospital Limerick campus. That hasn't happened. The Rotunda is meant to relocate to the Donnelly Hospital campus. Nothing has happened. Then Health Minister Leo Varadkar promised in 2015 that the Coombe would move to St James's in parallel with the Children's Hospital and would be, quote, well under construction by the following year, by 2016. Nothing has happened. In fact, there isn't even budget this year to begin the planning and design phase, which can take years. So what of the 2016 National Maternity Strategy? It's a good strategy. It's a solid plan. It has buy-in from patients, from doctors, from midwives, from politicians. As has become so common, there was a shiny brochure, there was a slick launch, and nothing has happened. The new hospitals are not progressing. There is no new funding this year. In a €17 billion health budget, there is no new funding for progressing new parts of the National Maternity Strategy. Community-based delivery options are not being supported, and most parts of the country don't exist. Diagnostic machines are not being replaced, and there is a huge variation in the level of diagnostics and scanning available to mums depending on where they live in the country. In writing this motion, we listened to women, we listened to midwives, we listened to doctors, and here's what they said. Maternity care must be safe. Maternity care must be of an equal standard for all mums and all babies, regardless of how much money people earn. The new maternity hospitals are needed now, where women can be treated with the best medical care and in appropriate settings where they can be afforded dignity. There must be community-based options for women who don't want to use the acute system for delivery, and they must have supports through pregnancy and afterwards. This includes counselling services and public health programmes like breastfeeding, which are underfunded and under-supported at this time. Ceann Comhairle, this country has a dark history when it comes to women's reproductive health. And that is on every party who has ever been in government. That is not solely the fault of this government. That dark history, every party who's been in government in this state has to take some responsibility for that. And we've got to do something about it together. Think of the scandals we've been dealing with. Symphysiotomy, women's reproductive health. Cervical check, women's reproductive health. Mother and babies' homes, women's reproductive health. And on maternity care, nothing is happening. Healthcare professionals, brilliant healthcare professionals, are burning out. They're trying to keep things going, but they're not going to be able to do it for much longer. Ceann Comhairle, mums and babies deserve better, as do dads, as do our healthcare professionals. We are capable of much better than is currently happening. This motion, if passed, but much more importantly, if implemented, would begin to achieve exactly that. I commend it to the House. Thank you.